Hey friends! Today I'm chatting with Rebecca Rowe, a speech language pathologist with over 15 years of experience and the owner of ACT Therapy Services. She's running 3 busy clinics in North Carolina, has a team of 22, and supports both OT and speech therapy services. But here's what makes Rebecca extra interesting. She's not just a clinic owner, she's also a total pro when it comes to negotiating insurance contracts. She's built a consulting business around helping other practice owners get out of those low paying contracts that are quietly draining our revenue. If you've ever felt stuck with your payer mix or wondered if you're leaving money on the table, this episode is going to be eye-opening. We're talking red flags, renegotiation strategies, and how you can boost your bottom line without adding more patients. Let's get into it. All right. Well, we'll just kind of get started. Welcome,
Okay.
Rebecca Rowe, and you're a
Thank you.
speech therapist of 15 years and the
Yes.
owner of ACT Therapy Services with 3 different locations in North Carolina, and you have 22 staff, and you
Yeah,
serve OT and
that's right.
speech, which is
Yeah,
amazing.
you can say
But
species. That's fine.
yeah, I mean, not only are you a clinic owner, what we're here to talk about today is that your consulting business helping
Yeah.
other clinics navigate insurance. So, can you just
Yes.
kind of talk to me a little bit about that?
Sure. Yes. So I think if you get on any Facebook group, you'll always see posts about taking insurance, not taking insurance, being private pay, and then just the difficulties around accepting commercial insurance. And so, really, what I'm going to touch on today is commercial insurance, not Medicare, not Medicaid, because we can't negotiate with those. But what I was reading and finding is that owners and solo owners, group owners, we're just really frustrated with the process of getting in with insurance, but also finding the right rate for them. And
Mhm.
so I, over the years, have been successful in negotiating our rates with multiple plans multiple times. And so I
Mhm.
really wanted to empower therapy clinic owners and or even just solo owners across PT, speech, OT, and mental health to have the power to ask for more money.
Awesome. So, let's kind of look at that big question. How does being underpaid by an insurance really just kill that pediatric therapy practice?
Think it's multifaceted in my opinion, and it's hard to pay employees well when you're
Mhm.
receiving very low reimbursement for your area, especially here in the year 2025, where everything is very expensive. And
Mhm.
so, as our testing forms go up, as our material fees go up, and our printer costs more to rent, and the ink is more, and the PLS 5 went up, the cost of it increasing our rates has to happen for us to open our doors and continue to attract quality therapists who want to do a really great job and be specialized because they're master level, some of them doctorate level. And so it's
Right.
really a struggle to accept low reimbursement rates and then attract quality employees.
So, what are some red flags that maybe the clinic's pair mix really needs to be looked at? Because I think we
Yeah.
just accept, right? We're just like, oh, I
Yeah.
got to take all these insurance, and we
Yeah.
live by fear.
Yes, and more
Yeah.
is not always better. More is not
Right.
always better. I think it's really important. It's very individualized because what's right for me on the East Coast might not be right for you on the West Coast. And so
Hmm.
I think
Hmm.
it's about looking at cost of living. I do a comparison to the Medicaid rate. And everything we take, in my opinion, should be higher than your state's Medicaid rate,
Absolutely. Yes.
but in all terms. I think that it just really depends on what your caseload looks like, excuse me, or what your therapists are specializing in,
Hmm.
and what kind of the demands of your area are as far as pay. Because I know,
Hmm.
again, I'm in our state. New York looks a lot different than North Carolina. Looks a lot different than Oklahoma or California. So
Right.
it's figuring out your nice little Excel spreadsheet of like what that person's rate is going to be, their salary with benefits, what you need to pay your front office staff, what you need to purchase for materials. And so
Mhm.
when you say red flags too, I do think a good payer mix is necessary because you don't want to put all your eggs in one basket.
Mhm.
So, I have I know of owners that only see children with Medicaid, and that's fine for them. I just choose not to do that, and I want to
Right.
keep a mixed bag in case of audits or governmental changes or state changes. And so I
Mhm.
think that's really important to remember.
Yeah. So what do you say to an owner when they just feel stuck? They're stuck and they just don't feel like they can make a change.
I think there's a lot of ways to effect change, and that's when we're, in the course. There's so many things that we can bring to insurance to prove kind of our worth, right? And it's a
Mhm.
conversation, and it's a considerate conversation, and it's about connecting with your rep at the insurance company first and
Mhm.
foremost, and being kind and respectful. But it's also about saying, "Here's what we're doing the best. Here's how we're educated. Here's how we use evidence based practice. Here are our outcomes." And it's having the correct data to present to the insurance
Mhm.
company on why you need an increase, and understand where they're coming from as well, or where your rep
Right.
is coming from, because your rep is doing their job by trying to save the insurance company money. I
Mhm.
do think that having parents in your back pocket of having families to advocate for you or your clinic is also, something that can be utilized. We kind of save
Mhm.
it. I usually save that for kind of the last resort. But we have had families contact insurance companies and say, "My child is not able to receive therapy if this doesn't happen." Um,
Mhm.
Insurance companies, they care about their customers, and they want to keep their
Mhm.
customers happy.
So, the question for you, I know that we
Mhm,
have a really hard time getting a rep or getting our provider rep,
mhm.
especially. We have like a credentialing agency that works for we're a part of. So I don't have to do the individual contracting, but I know that it can be really, really hard. So what are some tips that you give people to get the right people?
So you have to be a detective, which we're already detectives as
Yes.
clinicians, right? So I think it's using your detective skills differently. So ChatGPT, using AI to ask
Hmm.
questions like find this person for me.
Hmm.
LinkedIn can be really effective.
Hmm.
I know some of the insurances have really taken down their list of people working there after,
Yeah.
there's been some really serious things going on. So it's using that, but it's also, I figured out who to email one time because I had one person kind of lower down and I needed someone higher up. And I just took their email, I knew their name, structured it in the
Mhm.
same way, first name dot last name at insurancecompany.org, and it went to them and I got a
Mm.
response. So I think it's just like really honing in on what information do you already have and kind of filling out those holes with Google, with
Mhm.
LinkedIn, with ChatGPT. Um, and trying to find anybody. And sometimes I have to start with the completely wrong person, but
Mhm.
eventually over time, I'll
It'll
get
get
to the
there.
right person.
Yeah. So you have a course that people can
Yes.
purchase that kind of walks them through what to do,
Yeah.
would you say?
Yep.
Okay.
Absolutely.
Awesome.
Yeah. From start to finish, it gives every detail of information required, all the data that you'll need. It gives an editable letter that you can use to
Mm.
send to your rep. And it kind of it tells you how to advocate for yourself and how to
Mhm.
really make sure that you're asking for what you need.
Okay. When did you create this program?
Gosh, well, I've been dragging my feet a little bit. Within the last 2 years, I've
Okay.
had it for a while. And just, finally found the time and the
Yeah.
capacity to really bring it up and on board.
Yeah. It's a lot of work. I know that.
Yeah,
But so what made you like, because, it does take I don't know, some courage to negotiate. And I
right.
think a lot of us feel like, I don't know. So what made you be like, no, I'm going to take the bull by the horns. I'm going to do this.
I think growing up, like my mom always said to me, like, there's no, as long as you're being kind and respectful, you can ask questions, right? Always
Mhm.
feel free to ask questions, as long as you're being just respectful of the other person. So in my mind, no is not really an answer. So I'm a persistent person. I
Yeah.
just keep going until I get what I need. Um, so, you know, yes, it is scary. The first time I did it, I was like sweating, shaking in my boots. And I
Yeah.
kept checking my email to be like, okay, has my rep emailed me back yet? Like, what is she going to say? What if she says
Yeah.
no? But after you get that first one under your belt and you understand that there is going to be a 2 week lag between when you email your rep and they email you back, um,
Hmm.
they're working. My reps have said, I'm working on your behalf, I'm doing this as much as I can, I will get back with you. Just give me time. So,
Mhm.
um, once you get that first one under your belt, you really feel a lot more comfortable asking for what you want. And
Mhm.
I said this yesterday, and I want to say it again. As therapists, we just, a lot of us are very empathetic and
Yeah.
very, maybe have some people pleasing tendencies. And that's where you really have to separate your clinical treatment of clients
Yes.
away from the business side of it. And
Right.
remember that you have a business to run and you can't run it if you're not making revenue.
Right. I always kind of tell my husband, who's my business partner, but we have to think of it like it's not ours. Like we are running this for somebody else. What kind of a decision would we make on their behalf? Because it is so hard not to personalize it.
It is
You
so
make different
hard.
choices. Yeah.
Yeah,
Yeah.
it is so hard. And I think really just being, it makes me so proud to run a small business, which is mostly female, right? It's
Mhm.
female led. Um, and be able to look at my staff and say, I can give you a Christmas bonus. I can, increase your pay this year. I can give
Mhm.
you a pay increase. And there's a lot of agencies that cannot. I mean, we see it
Right.
all over the internet. There's
Mhm.
and maybe not every year it's possible and it is performance based, but there's a lot of agencies that you just really just don't ever make more money. And that's what it
Right.
is.
Right. Well, let's talk a little bit about the data. So,
Yes.
what data does a practice owner need to be aware of or really look at
Yeah.
before they begin that negotiation? What
There's
is
almost just
important?
like not you could just do everything is my answer, but
Uh-huh.
number of children with that plan, I do a cost comparison of if hey, if we have to go out of network, here's what we're going to
Hmm.
charge your customers versus here's
Hmm.
the money they're saving by using us. Discharge data of like here's the progress that we made with your clients in speech,
Hmm.
here's the progress we made at OT, here's the average time that they're with us. Here's how quickly we're meeting goals. In some cases, here's patient quotes about us. Like, here's how we're doing.
Hmm.
Here's our Google rating. Um, a lot of times you can see, how many people are near you that take the same plan, and that can be used to your advantage of like, I'm the only one in a 25-mile radius that can take this
Right.
plan for your customers. So all of that is really important to pull forward.
Hmm.
Um, and then I there's a little bit of in my opinion, there's a little bit of a competition between some of these major commercial payers,
Hmm.
and they don't want to be seen in a bad light. So they'll
Hmm.
say, "Oh, XYZ is paying you this much," and I'll say, "Can you meet that? Can you meet me there?" "Oh, yeah, I'm sure we can do that. Let me go back and ask." And then,
Okay.
the answer is
Okay.
yes, and they
Yeah.
will.
Yeah.
So I've used that to my advantage as well.
Hmm. Let's talk about tracking metrics a little bit because I
Yes.
think this is where we fail as a pediatric industry. I know adults that you have to track outcomes and all of
Mhm.
that, and at least in Oregon, it's not mandated yet for peds.
Yeah,
So
same
do
here.
you, okay, so what system do you use, number one? And then how do
Yeah.
you track that?
Yeah, so we use Fusion EMR, and
Mhm.
it's not perfect by any means. I
None of
mean,
them are.
I know. I've liked it for a long time. It does have some holes in it, but you can see length of stay, right? You can
Mhm.
see really the money, how much they were charged for their deductibles and copays versus how much we would have charged out of pocket for each session. You obviously we have the goal data of like their whole entire stay of like what goals were met or almost met, and
Mhm.
when were they discharged and why. So all of those things we can pull from Fusion, and we can break it down by
Mhm.
insurance and let
Mhm.
folks know that.
Okay, little bit time consuming, I'm sure.
Very time consuming.
Yeah,
It's a
and
lot.
do you do all that?
I have some help. My biller is very, very adept in Fusion, so she can pull different reports and send them to me. My office manager, he's newer to us, but he
Uh-huh.
does he gets in there and looks around and to pull various reports for us. So I have a little bit of help here and there. Sometimes it's just me going through and kind of pulling it out, and maybe I don't do all 75 patients with X plan, insurance plan, but
Right.
I'll do like
Right.
20 of those or
Right.
25 of those. So I think anything
Mhm.
that to do with numbers and
Mhm.
anything to do with client care is just very important to the insurance company.
Mhm. So it's really important that your clinicians are writing SMART goals, right? Yes.
Yes.
Yeah.
Yes.
And then that gives you some data too, as well as like
Mhm.
Sally here is really not pulling her weight and not meeting
Mhm.
goals and keeping kids on her caseload forever.
Right.
Yeah.
Right. Yeah.
Yeah.
So yeah, and it, and just the nature of the game, some of these kids are on our caseload for a long time, right?
Yeah.
Um, but some of them are not too. And so
Mhm.
I think that I do think that we're going to move in a direction where we will have to kind of prove our worth
I do too.
um, to insurance companies to keep
Mhm.
going. And I think that'll be very interesting. When I worked with adults, it was FINs and NOMs.
Yep.
And so I think that that will be coming down the pipeline for us. So I think
Mhm.
that will be very, very interesting when it does happen.
Yeah, but they don't quite fit the population that we see. That's the
Mm-mm,
problem. Yeah. I remember
mm-mm.
talking with an insurance company one time. They're like, well, what's their pain level? I'm like, they don't have any pain.
Yes,
What's their range of motion? That's not our problem.
yes,
They have autism.
that,
You
yeah,
know,
yeah. They can't
It's-
do daily activities.
right.
They can't get dressed, and mom is
Yeah.
having to dress this child at 8 years old. That's what we're working on, right?
Yes.
Or sensory integration, or them understanding how their brains and bodies work and advocating.
Yes. I
So
think there's so much education that needs to be done, but it's like, it's time consuming and you're
it
running a
is.
practice and it's like, I don't have time to do this, but we need to make time.
I know it is.
Yeah.
It's something that this year, I know it's June, but in 2025, I've been really focused on the back end and really
Mhm.
organizing the business itself and how we structure everything from front to back. And then going into 2026, my focus will really be on these types of things and really
Yeah.
streamlining them.
So do you work one-on-one with practices? Will you like get into their software and kind of help them look?
I haven't yet. I
Oh
haven't
my
yet.
gosh.
I give
Yeah.
all the tools to do
Mhm.
so, and like, hey, here's what you need to pull from your system. I haven't yet. My next course is coming down the pipeline, and it's really a start to finish on insurance billing notes and everything to do with Fusion EMR is what that
Okay.
will be. And just what you need to know to bill insurance, because
Yeah,
it's a beast within itself. But
it is.
this course that we're talking about is 30 minutes. It's quick, quick, quick. It
Wow.
really just
Okay.
focuses on either you're a new person to insurance and you're getting into your contracts, or you're established with insurance and you're looking
Mm.
to increase your rates. And so it's just a very quick down and dirty. Here's the tools that you need. This will get it done
Mhm.
kind of thing.
Okay. So currently you're not offering one-on-one consulting. It's just
I
mainly the course.
I am, but it's more about like just we talk through questions, back end,
Okay. Okay.
stuff like
Yeah.
that.
Yeah.
So, but that's such a good idea. You gave me a great idea
I think
of
you should
like,
do it because you know how we are. It's like you need somebody that holds you accountable and, because
yeah,
we put out fires every day,
I know. I know.
every
And I
single
will
day.
tell you, in May, I hosted this course live
Mhm.
on Zoom, and it was great. I think we had 18 to 20 attendees, all
Right.
OT, PT, speech, and mental health came,
Yeah.
owners. And it was, I presented the course and the content, and then we had 45 minutes of questions afterwards, and it
Mhm.
was just a fantastic discussion. And that's the thing of with us is a lot of people, we all are just limited on time. So there's not a lot of time
Yes.
to do this. And so making it short was necessary so that people couldn't spend, 5 hours learning how to do this. It's not
Mhm.
necessary. But also we have offer a Facebook group for accountability and ask
Mhm.
questions afterwards if you get stuck. Everybody can message in there or message me directly. And I offer one-on-one coaching about questions like, well, this happened, what do I do next? So
Mhm.
that
Mhm.
is something that we have going on the back end. But it was just,
Yeah.
I'm actually hosting it again on July 24th at 8 p.m.
Okay.
Eastern Standard Time. I'll be hosting it live again. And it was just such a great discussion.
Let's talk about kind of, I think what holds us back as clinic owners is we don't really know those like first steps. Like, what do I do? How do I get started? So,
Yeah.
what are your first steps in that negotiating like a pro? What do I need to do?
Yeah. You are going to just pull all of your contracts, right? You need to know, like, is it time? Can I, right? Can I
Mhm.
ask for an increase? So a lot of our contracts say 1 year, 2 year, 3 years, and some of them don't specify. So you need to really make sure you understand what each one says. And then from there, you're going to locate somebody to talk to you. Some of these insurance companies, some of these major insurance companies have numbers like direct lines you can call, and they have their big
Mhm.
building, right? And they're sitting in there. And you just you ask for the person that you need and they'll tell
Yeah.
you who it is.
Right.
I've done that several times already. And then you're going to pull all that the data we were talking about, the different types of numbers and stats and stuff like that. And then you're going to write your letter, and you're going to make sure that you input everything that's necessary into that letter. And you got to give a timeline. Please respond by X number of days. So
Right.
usually a week, right? And then the hardest part for all of us, because we're so busy, is the follow-up. The follow-up.
Right.
You have to stay on these people. I hate to say that, but you have to stay on them, because if you're not a squeaky wheel, they're going to forget about you.
Yeah. So what if they don't respond? I gave them a week. They didn't respond.
Yep.
What do you do next?
You call, you email, you continue to just you find someone else to talk to. You find someone else's email, and you email them, and you copy them together. I've copied CFOs on emails. I've copied CMOs on emails. That's probably frowned upon, but I've done it.
If no one answers, I mean, I'd want to know if my staff wasn't getting back to someone.
Yeah, it gets answered. It gets answered eventually. Somebody will get back to you. So, but I will say, I want to take it back to this, that for some of my major plans that are across the country, I've developed relationships with these reps. And so, you're not coming in super aggressive of like, I want $10 more for 92507. How was their weekend? How's the weather where they are?
Yes.
How is their holiday? What do they have going on this summer? And like, we have those conversations. And when I call, oh, hey, Rebecca, like they see that it's me calling from my cell phone. Oh, hey, Rebecca, like, how are you? It is relational and it's business. And so it's both of those things combined. And so you just can't go in guns a-blazing, because that's just not going to get you very far.
No, right. Like when they see you as an actual human, then they're more likely to listen. Yes. I love that. That's great advice.
Yes. Yeah. And I will say, to give you an example, last year, one of my reps, I had already negotiated speech 2 years ago. I called back, or I sent my letter to negotiate OT. And she was working with me, and she was like, I'll try, like, it's not time for you yet, but I'll try. And I said, hey, we're just really struggling here. Like, it's just not working for us. She said, I get it. I understand. And so then she called me back and said, hey, the way you've structured this breakdown per unit, I think it's going to be better if you do it like this. And she suggested another way, and actually like came to me to help me and said, do it like this, because you're more likely to get it from the higher ups. And I was like, okay,
that's
great.
amazing.
Thank you for that advice. Like, it was just really nice. And she didn't have to do that.
Right. But you had scratched her back, right? And she was going to scratch yours then. Yeah.
Yep.
Yeah.
So
what do you say to like clinic owners who, we all have a few dreaded insurers, right? And we're like, curse them all the time. But how do you tell them to walk away? When is it time to walk away? Obviously, when they're below Medicaid, people are still hanging on. And I think that fear is, but I got to serve the kids, or I can't let Johnny's mom down, or, how do you shift that mindset?
I think it's you've got to separate it. And it's like, I know this is overused, but you're on the airplane, you put your oxygen mask on first. And so you have to put your mask on before you can help others. And so I've met plenty of private practice owners over the years that aren't paying themselves or paying themselves.
Why the heck would you even do it? I would have been out.
Been gone, right? And so how they've structured it, because they felt bad, or they wanted to make sure their employees didn't leave. And I'm going to be honest, employees leave. You can pay them. I've experienced it. You can pay them top dollar, right? And give them a great schedule, and they're still going to leave because something else was more appealing, or they needed a change of pace, or they needed a change of environment. And so that was a hard lesson for me to learn. But I think that when we're going back and saying, I have to take this, you have to separate your feelings from the business. You don't have to take it. End of day, if insurance is not going to tell you what they're going to pay you before you sign on, or because that happens, people are signing contracts without knowing. And they're not paying you a fair rate. It's not worth your time. It's just not worth your time. It's not worth your time or effort. It was 2008, 18 when I moved to a different state,
Mhm.
right across from North to South Carolina. And I decided to get a network with an insurance here in South Carolina. And it was back in that day that your reps actually came out and met you. And I met her at a Starbucks and she was so nice. And I didn't know the rate yet. And she pulled open that contract and handed it to me. And she said, for 92507, which is speech therapy treatment, it's $40. And I looked at her and said, are you kidding me? Like $40. She's like, yeah, that's our standard rate. And I said, well, I'm not accepting this for any less than X number of dollars
Mhm.
because that is the lowest rate that I
Right.
have. And I didn't sign it. I didn't sign it. And I didn't sign paperwork. And I left and I told her thank you. And then I followed up the next week and we went through the process and they did end up raising it, which I was thankful for. But
Yeah.
gosh, you can't say yes just to say yes,
Right.
it doesn't work like that. So, and
Yeah.
I see that a lot. I see that a
Yeah.
lot.
We have to be aware that people don't have our best interests.
No,
And
no,
yeah. So,
no. They no.
so I know when you offboard an insurance, it's not just that simple. You have to continue, you've got to, alert your clients. You can stop taking any new of that, but
Mhm,
then you have to, to my understanding, finish out
mhm.
their plan of care and any
Yep.
other recommended plan of care. Is that right?
Yep. Yep.
Okay.
That's right. And that goes
Yeah.
back to reading your contracts because they're very specific
Mhm.
about that and about how you have to handle that. And so it's really important to read those contracts and make sure you understand that what your responsibilities
Mhm.
are.
Mhm.
And so I think there's a lot of steps before. I mean, I understand there's very special circumstances where you do have to end contracts regardless of how much they're paying you or whatnot. But yes, it's reading them and making sure. But if it's a payment thing, I think there's a lot of other steps you can go through to try first if
Mhm.
you're able to before ending it. I do want to say we have one plan here in my state where you may not negotiate individually. Um,
Oh.
and so we had to, as a state association, use our state speech association and use the power of that to negotiate
Mhm.
with this insurance. And we ended up setting it up where even with CMS cuts or whatnot, it was a plus or minus 3%. So it can never go up more than 3%, and it can never
Mhm.
go down past 3%, which is good and bad. But I'll be honest, in a few years, the rate's going to be too low again, and we're going to have to go back and negotiate.
Yeah. So do you keep your information? Like, how do you keep track of all these contracts? Do you keep them on a spreadsheet? What do you do?
I'm not very formal. No, they're all they're all in their individual inboxes in my
Okay.
email. I have folders for everything.
Uh,
So they're all in there. So they send you the DocuSign and
yep.
you read over it or have a lawyer read over it, really is the recommendation. And then, once I sign it, I get the final copy. I keep it in my folders. But we
Mhm.
do keep like a nice Excel spreadsheet of like all of our rates, all of them. So each insurance company has their own tab, and then all of our rates are listed out because, of
Mhm.
course, that's what we use to quote to families of
Right.
how
And
much
then
it's
do
going to
you also
cost.
keep on there like exclusions and all
Yeah,
of that? Yeah.
yeah,
Because
we have
that
it all
is
listed out.
a beast to keep track of.
It really is. Yeah, it really is. And we really we actually spend the time to call or verify
Mhm.
online for each plan. So
We do
once that
too.
patient makes an appointment, that's what we do because we want families to have that information up front
Mhm.
and be
Mhm.
prepared for the costs that they could
Mhm.
be incurring, and we don't want it to be a surprise because we
Mhm.
do bill on a daily basis. So
Yeah.
using credit cards.
So you don't necessarily have to have more patients, right? It's not just this kind of puppy mill thing. We just need to have
No,
better contracts,
I
right?
think I do. I
Yeah.
really think that's the ticket is fair rates. I mean, I'm not asking for
Mhm.
$200 a session. That's not even a number that's in our ball field here in North and South Carolina, but just fair not to, the codes, the treatment codes. And I'll be honest, something I want to say is that our treatment codes are sometimes higher than our evaluation codes, but we're doing much more treatment than evaluation.
Right.
So that's a stinky part, is that a lot of times we're not able to negotiate the evaluation codes. But we are able to negotiate the treatment codes, which, it makes a bigger impact.
The whole eval payment just chaps me. But it's also training your provider that they should be providing treatment during the eval. Like it
Yes.
should be happening.
Yeah.
Yeah.
Nope. And we do some of that for sure.
Hmm.
And we want to make sure that we're documenting that and being ethical. But yes, the evaluation rates absolutely kill me. It kills
Yeah.
me.
Yeah.
And so I haven't quite figured out. Again, I've been told no for the evaluation increases, and when you go, you want to just do the most at one time. So you're like, oh,
Yeah.
can I? Let me do speech. Let me do OT. Let me do treatment. Let me
Right.
do for both of those. And and they're just. I'm going to be honest. They won't do it. They'll say, we'll give you speech or we'll give you OT treatment, but not the
Yeah.
evals, and not maybe both at one time. So that's the downside.
Yeah. Ugh, it's frustrating. All right. So tell me, let's talk a little bit more about your course. Like how you said it was only 30 minutes. Like
Yeah.
that's nothing. I
Yeah.
think about that like we feel so stuck in like, oh, I gotta do this. But 30
Yeah.
minutes is nothing.
Yeah. It's very actionable. It's very like, hey, get your lunch, sit down, watch it. And then in the next week, write your letter and figure out who your rep is. So it's 30 minutes. It's evergreen. So it's available all the time on our website, rrtherapyconsulting.com. And so that is available all the time. It's $99. So pretty reasonable too for the
Yeah.
content. And like I said earlier, we are hosting it live July 24th at 8 p.m. Eastern Standard Time. So that one will be $110 just because we answer all the questions
Mhm.
afterwards and spend a lot of time on individual situations. Also on our website, you can find a freebie that I made about all the items and the data that you need to get this
Mhm.
process started. So it's a
Yeah.
checklist for you that you can print out or keep on your computer to figure out what you need to move forward.
Yeah. Oh my gosh, you're like giving this away for the amount of money that you're saving a practice.
Right. I know. And I
Yeah, there
just,
should be no excuse that everybody doesn't
yeah.
watch it.
And
Yeah.
I said this yesterday to someone else, but I'm going to say it here too is no one's coming to save you. No one's
No.
handing you money just to hand you money. That's not the way any of this works. And our associations, especially for speech, ASHA,
Mhm.
um, they're not coming to save us. They're not helping us whatsoever. They do have, gosh, what's the name? Like people in Washington, D.C., like, working with CMS, working with Medicare, working with a lot of the drivers, but they're not on the ground. They're not boots on the ground. They're not working with these commercial insurances directly like we are. And so nobody's coming to save us. So it's up to us to advocate for
Yeah.
ourselves
Mhm.
because our state associations try really hard, but our national, for us, at least for speech, it's just not happening. And
Mhm.
so for me, it's more about seeing everybody rise, right?
Yeah.
Um, Together, because we should all be making enough money to support ourselves and pay our staff super fairly and
Yeah.
make sure that they're compensated well for the excellent jobs that they do. And
Yeah.
so, that's where it makes the most sense to educate as many people as I can, because if we're all coming together, it's not a competition. If we're all coming to these commercial plans together and
Mhm.
saying like, we have to get this done, we have to have
Mhm.
this, then it's like, okay, got it.
Mhm.
Like, yep, we're underpaying. Yep, okay, we're hearing
Yeah.
this from 300 agencies now. What are we going to do
Yeah.
about it?
Right. And I think there's this like kind of burnout mentality and worth that, we're paid so low, we're just not worth that. And no, we should be paid very well for what we do. We have a very
Yeah.
hard job. And when you compare it to other, professions that
Yep.
whatever, real estate, whatever, like what we do is very important
It's
and
very
we
important.
need to advocate. And I guarantee
Yeah.
that if you made more money, there would be a lot less burnout.
I I think so too. I think so
Hmm.
too, because then it would also allow, in places where they're seeing, I'm just going to give an example, 70 speech kids a week for
Yeah.
speech, that's 35 hours of direct treatment time.
Yes,
And
that's
so,
a lot.
but you're doing that in exchange for a higher salary, right? Because your reimbursement rates are so low.
Yeah. Hmm.
And so it would allow us, as clinicians to back off a little bit, right?
Yeah.
And for me, what I think it's really done for our clinic in particular is being able to keep caseloads low,
Uh-huh.
um, and being able to provide just really quality care
Mhm.
um, to our patients. And so, our OTs are scheduled at 30 visits a week, but they usually see between 26 and 28.
Yep.
And our speech therapists are scheduled for 45, 30-minute visits a week.
Mhm.
And it allows me also to bonus them if they choose to work
Mhm.
more, if they want to work more. So
Yeah.
that's really, I think, what it's done for us is being able to make it like very achievable and a workload that feels very achievable for everybody
Mhm.
involved.
Mhm. Yeah. It's great. We all just need to kind of pull our head up and be like, we got to advocate for ourselves.
Yeah, for
Yeah.
sure. For sure.
Okay, kind of a wrap up question. So, can you give like one action that a clinic could do to kind of take that or get that momentum going forward to start that insurance process or looking at their contracts, whatever it might be?
Yeah, I think like the first thing that I kind of did was pull all of my contracts and get every single, if you don't have this already, every single rate written down, every
Mhm.
single rate for every single plan that you take. What does it look like? And then doing a cross comparison of per code, who's the highest, who's the lowest, who do we need to target first? And what does that look
Mhm.
like for us
Mhm.
in particular? And what would um a win be for our particular clinic, because it's going to look
Mhm.
different for everybody. Is that $1 more? Is that $10 more? Is that $40 more? And so looking through that and then just preparing your psyche to be a squeaky wheel.
Yes. All right. So, where can people find your live course that's coming
Yeah.
up?
Yes. So I'm on Instagram, RR Therapy Consulting, but also on our website, rrtherapyconsulting.com. Everything's right there. You can read about our course. We actually have two courses up right now, the insurance renegotiation course. And then I'm a myofunctional therapist. So I have a parent course
Okay.
about myofunctional therapy, parent
Nice.
and therapist. So that's up there too. And more content is coming later this summer, but everything's there. There's the freebie is there, the checklist that you can download and start using right away. And
Mhm.
you can read some testimonials about the course as well.
Okay. Now, I know this is going to be someone's question. If they can't
Yep.
attend live, should they sign up anyway and get the recording? Will it be recorded?
Correct. Yep.
Okay,
It'll be
perfect.
recorded.
And
Yep.
they can hear
It'll be
all the
recorded.
questions, which is
Yes.
usually the gold nuggets, right? Where you're like, oh,
It,
yes.
gold nuggets. We had
Yeah.
such a good discussion this last time. It was just really, it was really great. So I'm
Yeah.
looking forward to it. It was a fun thing to do. So I'm looking forward to
Mhm.
it again.
Well, Rebecca, thank you so much for blazing this trail for all the
Yes.
pediatric practices
Of
and
course.
providing the education at free. I'm going to say free because it's basically free.
It is low price. So
It
yes,
is very low price.
it's very accessible for everybody. But
Yes.
no, I'm happy to do it. And it's just a passion of mine is just bettering this field for everybody.
Yeah,
Because I'm really proud of what we all do and how hard we work and gosh, just all the skills that we have. But it's also we have to be paid fairly for those skills. So
we do.
it's important to
Me
me.
too. Yes. Awesome.